Yes, we can.
Perfect.
It's over to you then.
Thank you, and good evening from Denmark. And thanks to the organizing committee for inviting me to speak today. You just had your lunch, and here in Denmark the time is 7 p.m. and I haven't had any dinner yet, but I will manage. In fact, not eating for a certain amount of time, which we also call fasting, is exactly what I'm here to talk about today, including cardiac energy metabolism and why skipping meals might do more than just help you fit into your favorite genes. So let's have a look at it. So intermittent fasting has become increasingly popular in recent years as a potential strategy for weight loss and improving overall health. One specific form of intermittent fasting is alternate day fasting, which involves alternating between days of fasting and days of eating normally. Unlike other intermittent fasting protocols, such as the 16-8 method, alternate day fasting typically involves longer fasting periods, which may lead to significant metabolic shifts. And research has shown that alternate day fasting can lead to weight loss, improved insulin sensitivity, and beneficial changes in cardiovascular health markers. During alternate day fasting, physiological ketosis is induced, where the body increases its production of ketone bodies as an alternative energy source, especially when glucose availability is reduced. However, the specific effects of ketosis induced by alternate day fasting on cardiac substrate metabolism remain poorly understood. And under normal conditions, the heart uses fatty acids as the dominant energy source, but during fasting periods, ketones can become a key fuel for cardiac function. Physiological ketosis, which may be induced during alternate day fasting, is associated with increased levels of ketone bodies in the blood, which can have significant effects on heart metabolism. Ketones have been shown to provide an efficient energy source for the heart, potentially offering advantages for cardiac performance, especially under conditions of metabolic stress. And energy metabolism in the heart plays a critical role in maintaining a healthy heart function, and disruptions in this balance can lead to conditions such as heart failure and metabolic diseases. If alternate day fasting and ketosis can improve heart efficiency, it could provide valuable insights into how dietary strategies can be used to improve cardiovascular health. So based on existing knowledge, the aim of this study was to investigate how 3 weeks of fasting-induced physiological ketosis affects cardiac substrate metabolism, including the utilization of free fatty acids, glucose, and ketones. And we hypothesized that ketosis could lead to a more efficient cardiac performance by reducing myocardial oxygen consumption, increasing external efficiency, and improving myocardial flow reserve, all of which could contribute to improved heart function under ketosis. And to explore this, we used advanced imaging techniques, including multitracer imaging, to measure how the heart utilizes different energy substrates during fasting, especially ketones. And this allowed us to directly assess the impact of ketosis on heart metabolism and performance. So in this randomized controlled crossover study, we recruited individuals who were aged 55 to 70 years and had a body mass index of 28 to 40. And the exclusion criteria are listed on the right. And participants were generally required to be free from any diseases or medications that could potentially impact the study outcomes. Prior to enrollment, all potential participants underwent a screening process involving measurements of height, weight, heart rate and blood pressure, blood samples, and an echocardiogram. And additionally, demographic data and medical history were collected. And all included participants, they had to underwent both a 3-week period of standard diet and a 3-week period of alternate day fasting with a 1-week washout period between the 2 3-week periods. And the alternate day fasting consisted of alternating cycles of 36 hours of fasting followed by a 12-hour eating window. So the fasting protocol was structured such that day 1 was an eating day until dinner, followed by a 36-hour fasting period. And this fast therefore continued until breakfast on day 3, which marked the beginning of the next 12-hour eating window. And this 36-12 protocol repeated continuously over the course of the 3-week fasting period. And only tap water was permitted for consumption during fasting. And during the 12-hour eating windows in the fasting period and throughout the 3-week standard dieting period, the protocol required participants to consume at least 3 main meals per day. And these meals were to follow the Danish health authorities' guidelines for macronutrient composition. And these are based on the Nordic nutrition recommendations, which are 45 to 60% of energy from carbohydrates, 10 to 20% from protein, and 25 to 40% from fat. And during both 3-week periods, participants were required to measure their blood ketone levels twice daily at 12-hour intervals to ensure compliance with the protocol. And the ketone measurements were performed using a handheld glucose meter and reported daily to me. And participants were also instructed to maintain their daily routines and activities to ensure comparability of physical activity levels between the 2 3-week periods. And the day after each 3-week period, participants underwent a study day at the Department of Nuclear Medicine and PET Center at Aarhus University Hospital in Denmark. And the study days were proceeded as shown in this figure. The light purple boxes represent PET scans, while the dark ones indicate CT scans. And on each study day, participants underwent 6 PET scans using 5 different tracers, which were 15O water, 11C acetate, 11C beta hydroxybutyrate, 11C palmitate, and 18F FDG. Additionally, participants underwent a whole body DEXA scans at the end of each 3-week period to obtain measurements for body composition. I apologize for my dog in the background if you can hear her, but I hope we will manage. But participants, they were instructed to fast from 10 p.m. the night before the study day and to abstain from intake of caffeinated products and vasodilating medications 24 hours before the first scan. On the study day, low-dose CT scans were performed prior to the PET scans to establish anatomical correlation and attenuation correction before tracer injection. And the study day was structured to ensure adequate intervals between PET scans, allowing for sufficient isotope decay of the radio traces. So myocardial blood flow during both rest and adenosine-induced stress, they were measured using 15O water, and measurements of myocardial oxygen consumption and external efficiency, they were conducted using 11C acetate. Additionally, myocardial metabolism of ketones, fats, and glucose was assessed using 11C beta hydroxybutyrate, 11C palmitate, and 18F FDG. So between April 2022 and April 2024, 18 participants were included in the study, and of these, 2 participants were excluded, one withdrew consent after the first study day, and another participant who contracted a viral infection during the 3 weeks of fasting did not feel able to continue before the first study day. And therefore, a total of 16 participants, 9 women and 7 men, with a mean age of 61 years and a mean body mass index of 32, completed the study protocol. And during the standard diet period, the ketone concentration was quite stable. In the first week of the fasting period, the average ketone concentration of all participants gradually increased with each 36-hour fast until week 2 and 3, where the levels were relatively consistent after fasting days. And after the 12-hour eating window, average ketone levels dropped to around 0.2 millimole per liters. All participants, they were deemed compliant during both diet periods. And this table shows the results of the blood analysis, with hemoglobin and EPO being the only parameters unaffected by alternate day fasting compared to standard diet. All blood samples were collected on schedule at time 0 on the study days, ensuring consistency across all samples. And after 3 weeks of alternate day fasting, participants showed a reduction in body mass index by 1 and lost an average of 3 kilograms, including 1 kilogram of fat mass. But despite these changes, body fat percentage remained constant due to a concurrent loss in lean mass. The lipid profile, however, improved significantly after alternate day fasting. And now I will show you some graphs which summarize substrate and hormone measurements collected throughout the study days. First, we have beta-hydroxybutyrate levels, which were significantly higher after alternate day fasting compared to standard diet, with a median increase of 31 micromole per liter. And this difference persisted consistently over time and was unaffected by intervention order or timing. No significant differences in lactate concentrations were observed between fasting and standard diet, although a slight overall decline was noted during the study day. And fasting was associated with a small but statistically significant reduction in glucose levels compared to standard diet. Glucose levels generally decreased throughout the study days, but this trend was independent of the intervention type or order. And then we have insulin concentrations, which did not significantly differ between fasting and standard diet, though fluctuations were observed over time. And these changes were not influenced by the type of intervention neither. And free fatty acids levels were similar between fasting and standard diet and showed no significant effect of intervention type or intervention order. And the graphs for ketones, insulin, and free fatty acids, they clearly illustrate the timing of the hyperinsulinemic euglycemic clamp initiation during the study day. And during this period, ketone levels drop, insulin levels rise, and free fatty acids decrease as glucose availability increases. And the small decrease in glucose levels could suggest a potential improvement in glucose regulation. Other cohort comparable studies have observed similar but non-significant reductions in fasting blood glucose levels with intermittent fasting. However, although statistically significant, the small difference observed in our study may have limited clinical relevance, as such minor changes could fall within the range of natural variability or measurement error. And the insulin, free fatty acids, and lactate levels remained stable across the intervention, indicating modest metabolic changes with alternate day fasting in the short term within this cohort. Previous studies, they have shown mixed results regarding fasting insulin levels following intermittent fasting compared to a non-intervention diet, with no consistent trend emerging. And these discrepancies in fasting insulin responses may result from variations in fasting protocols, participant characteristics, and study designs, and factors such as fasting duration, participant health profiles, and dietary intake during non-fasting periods, as well as the length of the intervention and potential compensatory eating behaviors on non-fasting days. They could all contribute to this variability observed in study outcomes. And during the study day, the mean systolic and diastolic resting blood pressure, as well as mean resting heart rate, they were all statistically significant lower following the period of fasting compared to standard diet. Systolic blood pressure decreased with 9 and diastolic blood pressure with 3 millimeters of mercury, while heart rate decreased with 4 beats per minute. And the peak in heart rate shown in the last graph, it corresponds to the moment of adenosine-induced cardiac stress during the 15-hour water PET scan. And regarding the ventricular function, the cardiac output was significantly lower after the fasting period compared to standard diet, showing a decrease of about a half a liter per minute, corresponding to a reduction of 11%. And after 3 weeks of standard diet, left ventricular mass averaged slightly over 100 grams, while it decreased after fasting, showing a reduction of about 6%. There was no significant difference in end diastolic volume between alternate day fasting and standard dieting, and the change in end systolic volume with fasting was also not statistically significant. And finally, left ventricular ejection fraction showed a small but statistically significant decrease following alternate day fasting compared to standard diet, corresponding to a slight reduction in contractile function of 3%. And cardiac output was significantly lower following fasting compared to standard diet, likely reflecting an adaptation to reduced caloric intake during fasting, as the heart meets metabolic demands with less workload. And the reduction in left ventricular mass after fasting suggests possible structural adaptations, which may indicate reduced cardiac stress or a slight reduction in muscle mass related to altered dietary intake. Sorry. And both end diastolic and end systolic volumes remained unchanged, suggesting that despite the lower cardiac output and left ventricular mass, alternate day fasting did not affect ventricular filling dynamics. However, a modest 2% reduction in ejection fraction was observed, indicating a slight decline in contractile function. Similar modest reduction in ejection fraction have been noted by other studies following weight loss interventions, suggesting this could be an adaptive response to decreased metabolic demand rather than a pathological change. Although minor, this reduction in ejection fraction may hold clinical significance in specific populations, as it could influence overall cardiac efficiency and long-term function. And the reductions in systolic and diastolic blood pressure and heart rate observed in our study are consistent with prior research on the cardiovascular benefits of intermittent fasting. The blood pressure reduction may be due to improved autonomic control reduced sympathetic activity, and lower oxidative stress. It could also be associated with improved endothelial function and reduced vascular resistance. These findings, they suggest that alternate day fasting could be an effective non-pharmacological strategy for blood pressure regulation and cardiovascular strain reduction, especially in individuals with elevated BMI. And the observed systolic and diastolic blood pressure reductions are particularly relevant, as even small reductions in blood pressure are associated with a decreased risk of cardiovascular disease. Oh, sorry. And then we have the myocardial perfusion. And the mean myocardial resting perfusion was lower after fasting compared to standard dieting, showing a significant decrease of about 9%. And the myocardial perfusion during adenosine-induced stress was not statistically significant different between the two diet periods. However, myocardial flow reserve showed a significant improvement after fasting, with a 29% increase compared to standard dieting, indicating improved capacity for coronary flow augmentation, which could benefit individuals at risk for ischemic events by providing a better protective buffer during increased demand. And this effect may be attributed to improved endothelial function. Research in both animals and humans suggests that fasting helps small arteries relax more effectively, improving blood flow. Fasting also triggers processes like autophagy, which repairs damage in the blood vessels. The observed improvements in myocardial perfusion and hemodynamics may also be attributed to vasodilating effects from ketone bodies known to reduce systemic vascular resistance and afterload, thus supporting efficient cardiac function during alternate day fasting. And regarding the myocardial energy expenditure, then we had the myocardial oxygen consumption, which decreased significantly after the fasting period compared to after standard diet, showing an 11% reduction. And there were no significant differences in myocardial external expenditure between the two diet interventions. And total energy use significantly decreased following the fasting period, with a reduction of 19% compared to standard dieting, which indicate a lower overall energy demand after fasting. And then the total external work also decreased significant following the fasting period, with a reduction of 17%. And the significant 11% reduction in oxygen consumption after fasting may indicate improved cardiac efficiency during fasting periods, as the heart requires less oxygen to maintain function. And such efficiency can be beneficial in reducing overall cardiac workload, especially in individuals at risk for heart-related complications. The reduction in oxygen consumption likely correlates with the observed reduced blood pressure and heart rate, which lower myocardial oxygen demand. In contrast, the myocardial external efficiency was not significantly different between the two diet interventions, suggesting that while oxygen consumption has decreased, the overall energy expenditure remains stable, possibly as an adaptive response to energy restriction. Moreover, total energy use decreased by 19% after fasting, while external work declined by 17%, suggesting that the heart achieves necessary circulatory demands with less mechanical energy output, which could further minimize strain on cardiac function. And these findings are substantial and indicate potential protective benefits for myocardial energetics and efficiency on the alternate day fasting. And then when looking at the substrate metabolism, alternate day fasting resulted in a slight reduction in the myocardial fatty acid esterification rate, though this change was not statistically significant. Sorry for that. And both the fatty acid oxidation rate and the fatty acid uptake rate remained largely unchanged between the two interventions. And the mean glucose metabolic rate showed also no significant difference between the interventions. And similarly, the uptake rate of beta hydroxybutyrate in the myocardium did not change significantly after 3 weeks of alternate day fasting compared to standard dieting. So alternate day fasting did not result in significant differences in myocardial substrate metabolism. And minor non-significant reductions in fatty acid esterification rates following fasting suggests that fasting does not strongly impact free fatty acid utilization in the myocardium. Similarly, fatty acid oxidation and uptake rates were stable, indicating consistency of free fatty acid metabolism between the interventions. And this pattern extended to glucose metabolism, with the glucose uptake unchanged between the interventions. Notably, ketone uptake remained stable despite elevated circulating ketones during fasting, suggesting that alternate day fasting does not substantially alter myocardial substrate uptake or oxidation rates in the short term. This stability could indicate that the heart maintains metabolic flexibility and energy production despite fluctuations in nutrient availability under fasting conditions. So future studies may help elucidate if prolonged fasting could induce more metabolic shifts not observed in this 3-week study period. So just to summarize, we evaluated the effects of 3 weeks of alternate day fasting compared to a standard diet on metabolic and cardiovascular parameters in a cohort of healthy middle-aged adults with elevated BMI. And we found a marked increase of 29% in myocardial flow reserve with unchanged glucose, free fatty acid, and ketone metabolism. And additionally, significant changes were observed in systolic and diastolic blood pressure, resting heart rate, and energy expenditure, suggesting that alternate day fasting may reduce cardiac workload and lower resting energy expenditure. And thank you for listening.